Hey guys, it's Terry again, and today we're going to talk about dental implants versus dental bridges. Let's jump right into it. Dental implants and dental bridges are fixed solution in replacing missing teeth. Each options have its own advantages and disadvantages, which can influence your choice based on your dental needs, health, and financial situation. Okay? We're going to talk about dental implants. Dental implants consist of three main components. Implant, a titanium screw-like post placed into the jawbone to serve as a stable foundation for replacing teeth. This one right here. Through osseointegration, the implant bonds with the bone, creating a permanent structure. This is the abutment that goes in there. This attached to the implant, linking to the replacement tooth. Then after that, you have a crown. It's a prosthetic tooth that designed to match the proper tooth shape, size, and color. Okay? This is how it's placed. We're going to talk about the advantages. Durability and longevity. Implant can last a lifetime with proper care, making them cost effective in the long term. Preservation of jawbone. Implants stimulate the jawbone, preventing bone loss and maintaining facial structure. Let's talk about aesthetics and functionality. They look, feel, and function like natural teeth without lying on adjacent teeth for support, reducing the risk of decay and gum disease. Disadvantages. Cost. Implants are more expensive due to surgery, the implant itself, and the crown. Surgical procedures. Well, there's placement requires that carries risk, infection, nerve damage, and sinus complications. Healing can take several months. The time commitment of it. Time commitment is the process involved. It's like multiple visits over several months. And we're going to talk about suitability. It's not everyone is a candidate for dental implant, especially the one who has significant bone loss or other health conditions. Let's talk about bridges. Do you know anyone who has a space like this in their mouth and don't know what to do with it? Well, the first option is actually do nothing. Second option is to do an implant or a bridge. So let's touch on the bridge. So what happens is the dentist comes in, you go to the dentist, he comes in, he gives you freezing. Freeze these three spots. Okay? Now, he shaved the tooth, this tooth and this tooth, around a millimeter around the tooth, right? After that's done, this is what it would look like. Okay? So now the tooth is all shaved around a millimeter, prepping it, ready to go. After that, he's going to take an impression. And after we take an impression, he's going to send that to the lab. But before we do all that, we're going to definitely make your temporary bridge, which in the beginning, what we did, we took an impression of the tooth first, and then we make a bridge just like this, temporary bridge to send you home with. And then after we send it to the lab, you get the lab send it back with a permanent, and we cement. Okay, these are cemented. All right, cemented on top of the two adjacent teeth, and then this is your permanent fix. And you can chew as normal. Okay, so we're going to jump right into what a bridge is consist of. So a dental bridge replaced missing teeth by using the adjacent teeth as support. The process involves preparation, as I just said, the two adjacent teeth. They're shaped to make room for the bridge. Impression/scans, custom impression or scan are taken to create a precise fit. Fabrication. The bridges consist of artificial teeth, pontics, and crowns. All that is made in a dental lab. When they send it back, we're going to cement it. The lab is going to send the bridge back. We're going to cement it over the prepared teeth. Let's talk about the advantages. The bridges are cost effective. They're less expensive than an implant. It's a pretty quick procedure. The placement is a bit faster. Usually it's completed in a few weeks. There's no surgeries. No surgeries is required. Bridges avoid surgical risk, restore functionality and aesthetics. They improve chewing, speaking, and aesthetics. Disadvantages: impact on adjacent teeth. Bridges rely on adjacent teeth for support, requiring enamel removal, which can weaken these teeth and increase the risk of decay and gum disease. Bone loss. Bridges do not prevent jawbone deterioration, which can lead to changes in facial structure. Let's talk about longevity. Bridges typically last 10 to 15 years, requiring replacement over time. Maintenance. Proper oral hygiene is essential to prevent decay and gum issues. Flossing around the bridges can be challenging. So all I can say, my conclusion is, the choice between dental implants and dental bridges depends on factors like oral health, budget, and personal preferences. Dental implants offer permanent, natural-looking solutions that come with higher cost and longer treatment process. Dental bridges are more affordable and quicker to place, but may not provide the same long-term benefit and require replacement over time. If you like this video, please comment, like, and subscribe. Send it to a friend. One love.